Hello, this is Dr. Stanley Lang, and welcome to this presentation, which is on the subject of, is it Lyme disease? Is it Lyme disease? And the reason that I'm wanting to talk about that question today is because I saw two patients today with very strange symptoms that I thought I would share with you that would maybe get you thinking about, could what you have be Lyme disease? Now, the context for all of this is a whole person health approach that I use for taking care of patients. And I think people have the best outcomes when we integrate body, mind, and spirit. And also when we, in the physical realm, integrate strategies that are not just traditional medicine, but other modalities that help the body to be physically healthy. So the two patients in question have had symptoms going on for almost a year. And one is a relatively young woman, one is a relatively older woman. And in both cases, they have symptoms that don't fit other diagnoses very well. Now, one of the things that I have started to adopt as a strategy, because I practice in a part of the country where Lyme disease is epidemic, is if it doesn't fit a diagnosis really, really well, then Lyme disease jumps to the top of the probable diagnoses that I consider. And even if it does fit something else pretty well, I still consider Lyme disease as a possible explanation for the person's symptoms. And in this case, one of these patients has been having strange neurological symptoms. Initially, the doctors thought that she'd had a stroke. Then they thought she was having TIAs, which are like mini strokes. Then they thought that she had been possibly having seizures. And she saw 3 different neurologists during this time and had a bunch of neurological tests done. So this isn't just done by uninformed people that don't know anything about neurological disease. She's seen 3 different neurologists, still doesn't have a diagnosis. And when her symptoms get a lot worse, she has severe anxiety episodes. She goes to the emergency room, and people think, at least the people that she sees there, think she's crazy because she is having such a severe anxiety reaction to the symptoms that she's having. And so about 2 months ago, I told her that this could be Lyme disease, but that we would continue to do the necessary tests to rule out other neurological conditions. Well, as of this visit, I told her I really thought that she should have a trial of treatment, even though her Lyme disease blood test was negative, as it is more often than not when I think that the person might have Lyme disease. And because the Lyme disease test is very inaccurate, it misses a lot of people who do have Lyme disease based on their dramatic response to treatment for Lyme disease. I have come to less and less regard it as useful at all. And about the only time I order a Lyme disease test now is when the patient requests it. Now, there are some Lyme disease tests available in the country that are much more accurate than the standard one available to most clinicians. But for most clinicians, and therefore most patients, they don't have access to these more advanced tests, and they don't have the resources to pay for it out of pocket. So the trial of treatment is what I recommend. And so there are 2 different strategies now that we can use. One is antibiotic therapy that is tried and true, works most of the time for when it is Lyme disease, except in more advanced cases, which I won't get into here. But there's also a natural strategy, a couple of different natural strategies that work pretty well also. And I've developed one of these natural strategies to a point that I think it's actually better than antibiotic therapy, though I always offer antibiotic therapy as a first start. But if you're interested in whether or not you would be a candidate for a trial of this more natural program, it doesn't require a prescription, and you can get a copy of the overview of it in the link below this video, and you can see what's in it and whether it's something that you might want to go the next step and get. Now, the second patient was a younger woman who'd had a bunch of strange musculoskeletal symptoms going on for a year, mainly involving her legs. uh, different kind of aches and pains. She'd been diagnosed with restless leg syndrome, didn't really have a good picture for that. And then she started to develop some strange swelling on just one leg on the side of the leg. Whenever I see strange swelling that doesn't match anatomical patterns, I'm very suspicious for Lyme disease, because every time I've seen that, it turned out to be something that did respond to antibiotic therapy. So I told her she probably had Lyme disease. And we reviewed the different options. She could do various tests to try to rule out different conditions. She wanted to jump straight to treatment, trial of treatment. And because doxycycline is the most common antibiotic used, I really feel that it's almost unethical to not make this option available to patients who are suffering from what is a very serious condition, considering the fact that this drug is given to kids with acne for months on end without the doctor blinking. So to think that somebody with Lyme disease can't have at least a 3-week trial of this antibiotic, I think is not reasonable. But even better now, we have these natural strategies that we can try first, especially if the person isn't critically ill. So the point is, strange symptoms that don't have a good solution or have not responded to usual medical therapy, it could be Lyme disease. And just because you don't live in a part of the country where Lyme disease is thought to be common, it's a lot more common than people appreciate. And so just to get more insight into what would be part of a natural program that doesn't require a prescription, click the link below this video and it'll give you more information. So hope you found this helpful. God bless and have a great day.